This meeting is being recorded.
Okay, so Dominika, what we'd like to know in the group is about the treatment at Klara Medical Center. We're a group that deals with stem cell therapy. There are some people that are doing, most of the people in the group are doing it for autism, but there are other conditions that are have interest. So we'd like to know what kind of treatments you do at Klara, which conditions, how the different protocols will be seen, what ages, what can you tell us?
Okay, so we are a hospital based in Częstochowa, Poland. For the past 8 years, we've been conducting a medical therapeutic experiment. The reason why I'm calling it that is due to the Polish law. We cannot administer stem cells in any other way, or perhaps if it's a clinical trial. So we have to do it under the restrictions of a medical therapeutic experiment. And the stem cells that are provided by our hospital are mesenchymal stem cells, which are derived from wharton jelly, which is a part of the umbilical cord from an unrelated donor. Our stem cells are produced at the Polish Bank of Stem Cells in Warsaw. And the Polish Bank of Stem Cells in Warsaw is responsible for the entire procedure, from getting the donor, receiving all the approvals, all the testing of the material, and then, of course, the production of stem cells itself for each individual patient. At our hospital, we deal with mostly neurological diseases, not only autism, but also multiple sclerosis, ALS, muscular dystrophies. We have some patients with various types of ataxia. We had patients with spinal muscular atrophy, but this is a very difficult, disease to treat. So it's pretty much a minor amount of patients that are qualified. Cerebral palsy, but also depending on the patient's state. We also treated patients with epilepsy, Devick's disease. We actually had one patient with moyamoya, which is a disease that is very rare worldwide. The patients that are qualified are between 3 years old and 85. We actually put a very big age range due to the fact that with some patients, age should not be an issue. But we rather not treat patients that are younger than 3 years old because the travel for these patients is very difficult, and that's one of the main reasons.
Is there any risk for children that are younger, or?
I mean, it really depends. It really depends on the stem cells that we administer are mostly intravenous injections. With some diseases, we also do it intrathecally. But because we like older patients is due to the fact that we know much more about them. The stem cells are, of course, tested in every possible way, but in the stem cells itself, there's some products that are added, such as antibiotics for, of course, the stem cells to be safely administered to patients. And some patients may have allergic reactions to the antibiotic that is actually included in the stem cells. So if a patient were to have an allergy to penicillin G, then they should not go forward with the qualification. Of course, with younger patients, parents don't know exactly if there are any allergens that can cause such a reaction. So that's why all injections we start with intravenous ones to see how the patient will react, if there's any rashes in the place of the injection, and if so, then we can conduct additional tests to actually either include or exclude the possibility of such an allergic reaction. If, of course, the patient were to be allergic to penicillin G, then he or she is excluded from further participation, because this may actually lead to death, as with most allergies. In regard to the qualification process, all patients are qualified the same way. Patients are to send us medical documents that confirm their diagnosis. They have to, of course, do additional laboratory tests from blood that will exclude viruses such as HCV, HIV, and HBS. And because most of our patients are from Europe, we also like to include the testing to be for Lyme disease, because a lot of patients do have had contact with ticks, and some diseases such as multiple sclerosis or ALS may mimic as Lyme disease and the other way around. So we want to actually exclude any most common bacterial or viral infections.
Lyme disease can't be treated with stem cells?
It can be treated, but if a patient were to have Lyme disease and, let's say, autism, then the stem cells would actually go to treat the Lyme instead of actually starting the regeneration process with the, let's say, autistic patient.
And that wouldn't help with the autism?
We don't know.
Okay.
I mean, it's a very big question mark. You treat Lyme disease with antibiotics. So if a patient were to have Lyme disease, then he or she would conduct a 3-month antibiotic treatment, and if that will give us an all clear, then we can go back to the qualification process. Okay. So that's pretty much it in regards to how we qualify patients. Then the next step is, of course, like I mentioned at the beginning, because this is a medical therapeutic experiment, by law we are obligated to move forward with the next step, which is the bioethical commission. And we file everything that the patient is sending us. We also file a protocol, and we send it all to the bioethical commission for their approval. That usually takes about 2 to 3 weeks for them to review our files. And once we receive an approval, then and only then we can place an order for stem cells to be produced for each patient that was sent to the bioethical commission. And unfortunately, because we have new laws in Poland, the stem cell production takes 3 to 5 months for each patient. So we understand that it's a longer process than it way going around it.
Okay, so it takes you receive the medical
from day 0, when the patient sends us all his documents, to the first administration, I think it's safe to say that it's about 6 to 7 months.
6 to 7 months, okay. Okay, now in terms of the treatment for different conditions, are the protocols different?
Yes, with all patients under the age of 13, we do only intravenous injections. However, in diseases such as muscular dystrophy, autism, cerebral palsy, epilepsy, we only do intravenous. However, with multiple sclerosis and ALS, we combine injections, intravenous and intrathecal, and that also depends on how much the patient weighs. So the protocol does vary, but then a medical therapeutic experiment dictates that we provide the bioethical commission with individual dosage treatment plan.
Okay. Now walk me through the treatment protocol. Let's say I've gone through the whole qualification process. I've decided to be treated, let's say a child with autism, to have my child with autism treated in Klara.
Yeah.
How does it look like? What happens?
Okay, so you sent us all the files, you have an approval, correct? And we established that you will be coming on the 14th of March, let's say, for the first treatment. So patients arrive usually either on a Monday or on a Wednesday. We actually we confirm the dates for the parents to be as flexible for them as possible. The first day of is admission, where there's consultation with the doctor, and with a patient with autism, we actually bring in a psychologist from a different hospital. So our so the test is not biased, so it's a different psychologist. We do blood work. The next day is the stem cell administration, and then the patient stays for observation until the next day.
So on the first day, I have consultation, psychologist assessment, and blood work.
Yeah.
Okay, what happens in a psychological assessment?
It really depends on the patient's state. So the first day, the psychologist is actually gathering information on behavioral and any other tests that is required, or a patient can actually perform, because with as you know, some autistic patients cannot proceed with additional testing. So this is our baseline for therapy.
Okay.
So it's a complete evaluation.
Okay. And then if I remember correctly, the patient can come back for additional treatment?
Yes. So once we have an approval from the bioethical commission, the patient can have 10 injections in total. One injection is being conducted every 4 to 6 weeks. After the 5th injection, there is a 6-month break. With some patients, we can actually shorten the break, and the doctor who is responsible for our pediatric patients sometimes actually asks parents to shorten the break because we have good results. And then if there were to be a 6-month break, then you can also always come back for the additional 5 injections. So the whole treatment takes, if you were to conduct it, a year and a half.
So if the years and a half is the maximum, you can actually have it.
Yeah,
in
that's the
less-
maximum. Yeah.
you- with some restrictions, you can have the whole protocol in less than a year and a half.
Yes. Yes.
Okay, in some conditions, okay. Now, as I said, most of the people in our group are parents of autism, so that's the main interest. We do have someone with Parkinson's. Is that somebody that can be treated at Klara?
That's for individual assessment. We would
Okay.
have to gather information. Of course, the disease itself provides the possibility, but we always assess each case individually.
Okay. Now,
So we have to take into account if there's any additional diseases that the patient is suffering from, such as cardiovascular. Does he or she have any history with cancer, etc.?
okay. What are the risks of the treatment?
So like I said before, the stem cells are tested in every way possible. If the patient does not have any allergies, then it's safe to say that the stem cells are should not cause any side effects. Of course, during the administration, we have seen such symptoms as headaches. We had patients vomiting a little bit, but that's because they ate right before the stem cell administration. We have not had any serious side effects at our hospital since we started. But of course,
Explain why somebody would vomit?
because the stem cells that you receive intravenously have a very specific taste on the mouth. Some patients say that it tastes like corn. Some patients say that it tastes like raspberries. And some patients say, I don't know if you ever received anything intravenously, any drug?
No.
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 So if you were to receive any sort of drug intravenously, you will always feel its taste on your tongue. And stem cells are, of course, a biological drug, you would say. And they also leave a taste mark on the patient. And with some patients, they say that they taste a very metallic sensation. And just because this is a very strong taste, if they eat right before, it just happens that they may vomit a little bit because the taste mixes, and that's just a normal reaction. That's why we always ask patients not to eat 2 hours prior the stem cell administration. In regards to intrathecal injections, of course, there is always a risk you receive it in the lumbar part. So if perhaps the patient were to jump during the administration, then the needle might break, and this may cause a different effects on the patient. We would have to conduct a procedure, etc. But the stem cells itself are safe to be administered.
Okay. There's no risk for the stem cells to be administered into the spinal fluid?
Like I said, not the stem cells itself, but the procedure may cause side effects. If the patient doesn't listen to the doctor, this may cause side effects that can be dangerous. Yes.
Okay.
Any lumbar procedure can cause that. Not only stem cell administration.
Okay. Mo is asking if the taste is because of DMO.
DMSO, yes, that is correct.
Okay. What kind of success rates do you see for children with autism?
Actually, with all our autistic patients, we have had very good results. Of course, this is not a big number of patients that we have treated, but with all of them, there has been progress. I think that the one that we're most proud of is a patient that was, I think he was 7 when he started therapy. He was going to a special school, and after 13 injections, he went to a quote normal school for other kids. So he was a patient that did not speak, and he actually, after the 5th injection, he started communicating with us
Verbally?
verbally, but with less short sentences, I would say.
Okay, so
So
it's completely nonverbal before, and then after
completely
5
nonverbal,
injections,
yes.
started
I was actually present 3 years ago on a conference where there was the topic of stem cells and autism, and I would also like to confirm that with patients that have a lower IQ and with more difficulties, we find that there is a much greater benefit from stem cell therapy than patients with that are more advanced and have lesser, I would say, problems with everyday life.
Mhm. Okay. You mentioned that a child received 13 injections, but you said that the maximum is 10. So
For one bioethical approval, if the patient wants to continue after those 10, he can as well.
oh, you need to go through the whole process again
Yes,
after you
yes.
finish your year and a
And
half.
then exactly, it's the without the additional test, of course, if there is a ground that the patient should have additional blood work done, then he has to. But if there's no indication of that, then there is no problem. But then we just file additional documents to the bioethical commission, adding what kind of progress the patient has made, and then they base their evaluation on that rather than go through the qualification process from the beginning.
Okay. Now, you said that you only treated a few children with autism. How many approximately?
It's about 20 patients.
What are the age ranges?
Age range, I would say it's about between 4 and 16.
4 and 16. Okay. We've had somebody asked about the treatment for autism with a person that's 23.
Mhm.
Is there any indication not to do a treatment at that age, or
I mean, it's a yes and no answer. Yes, you can always try it, but on the other hand, once we have once the patient is older after puberty, this is sort of a problem with stem cell therapy. I'm not saying it's not possible, but it's much more difficult than with younger patients to
so
actually receive.
puberty is an issue that makes the stem cells less
Yeah, less
sensitive to
effective. Yes.
autism? Okay.
Yeah.
We have another question. What's the advantage of the like lots of little um, treatments versus places that do one big treatment every half a year?
Can you tell me what do you mean by big treatment?
Um, how many cells are administered in an injection?
We the first 5 injections we do 1 million stem cell per kilogram.
Because we've heard of places that do 2 million per injection,
We
or
can do that, but in the second round, we don't want to administer so much stem cells when we don't know how the patient is going to react. So we can do that after the first 5 injections if there is no cause that could actually derail us from that route. But our protocol does give us the possibility to administer 2 million stem cells per kilogram.
okay. Is that true for any age?
Yes.
Okay. And we've heard that Professor Kurtzberg in the US, she's administering 6 million cells per injection.
But she's doing that with cord blood.
No, well, with MSC.
Is she?
That she hasn't released the papers yet, but the clinical trial that's registered, and she went on a video about it. She's talking about injecting 6 million per kilo in one injection every 6 months, I believe, or maybe just one injection of 6 million. But that's definitely something that she mentioned in the video, and that's what's registered on clinicaltrials.gov.
I cannot comment on that as I don't know. I know that she has been conducting that. I actually spoke to her 3 years ago during a conference, but that was stem cells from the cord blood, where it's a different kind of dosage because they're just different stem cells altogether. But in regards to MSC, unfortunately, I cannot comment on that.
So in Klara, we can have a 1 million in the first injection and the first 5 injections, and then we can go up to 2 million. Would that be a suggestion for, or some patients will be recommended to take 1, some maybe 1.5, and others 2?
It really depends on the treatment, how the treatment will go, and it's very individual. So
And
we
how much does all of this cost us?
So I would need to receive the patient's weight.
According to patient's weight? Okay.
Yeah, because we always do our treatment plan in regards to the cost on how much the patient weighs. So if the patient weighs, let's say, 20 kilograms, he starts the therapy with 17,500 Polish zlotys. So that's per injection. If we were to double that, giving us 2 million stem cells per injection per kilogram, so that's 40 million, then the price would be 26,200 Polish zlotys per injection.
Okay, so that's for somebody that's 20 kilos, and
between 1 and 2 million stem cells then.
Okay. You said for 2 million, it would be 26.
20 million, 17,500, and 40 million, 26,200.
Okay. Okay. And then for a patient coming in from another country, it's flying in, it's renting a hotel nearby for 3 days. Okay.
The patient can stay with one parent at the hospital for the entire stay. We actually also, if there's any dietary restrictions, we also have a catering company that brings us meals for patients from the outside. So if there's any gluten or other allergies, then we can provide that as well. But most patients come in with both of their parents. So one parent will have to stay in the hotel nearby, and the other parent with the patient at the hospital.
So there are accommodations in the hospital?
Yes, for one parent and the patient.
Okay, accommodations for a patient and one parent. Okay. I had a list of questions for somebody else. I'll see if there's anything specific that that we might want to ask you, because I think we've covered everything. So in terms of the safety of the cells, they travel from your hospital, the Wharton Jelly.
They are transported in a medical vehicle from the Polish Bank of Stem Cells on the day of administration. They travel 220 kilometers to our hospital.
Okay, and the cords, they're collected from your hospital or in a hospital in Warsaw?
No, they collected from just donors that are willing to provide the Polish Bank of Stem Cells with such material.
Okay. Do you have any knowledge about exosomes? Is that something that you deal with in Poland?
I would need to receive an email about that, and then I would look into it.
Okay. Okay.
Okay.
Any side effects for autism? Some parents report some kind of regression for autistic kids before they show gains. Is that something that you've seen?
No, we have not observed that. No.
Okay. Cells are what kind of process do the cells go through in order to be processed?
It's a long list. If you would like, I can send it to you via email with all the testing that is performed for the production process, if that's okay.
I think some people in the group would be interested in that.
Yeah, I can provide that information, no problem. But I think it's a long chat, so if it's okay, I would prefer to send it by email, so you can send it forward to all the parents.
Yeah, some people care about that. Some people it's too complicated, but that'd be something important for those that look into that. Mo is asking again, what are the benefits of doing this protocol with multi-injections?
So as you know, the more stem cell you administer, then the regeneration process begins. And we see by doing injections every 4 to 6 weeks, progress in different areas. So if you administer it only once, then, as you know, the stem cells only live about 2 weeks in the body of a patient.
2 weeks. Okay.
So yeah, it's about 2 weeks. So if you don't do it continuously, then it's only once, and what they were able to do is done,
Mhm.
and that's it.
Okay.
So if you do it repeatedly, then you always add additional stem cells that can work in different areas that the body needs to.
Okay. So if the stem cells only live for 2 weeks,
Mhm.
then why do we take 4 to 6 weeks between injections?
We've gathered this from different medical papers that this is the best time to actually do the stem cell administration. That was prepared by one of our transplantologists. So I actually didn't question that. Sorry, I don't have an answer. That's just our protocol.
Okay. Um,
Why is the max 10? This is just according to our protocol. We don't know how much each patient will need. Like I said before, there were patients that underwent 13, some underwent 16. So this is what we start with. Of course, like I said before, because this is a medical therapeutic experiment, we have a lot of restrictions on the therapy itself. So we had to come up with a number that would be acceptable by the bioethical commission to grant us this possibility. Of
okay.
course, then you can receive an additional 10, an additional 10, but this is what we have to start with.
Okay. Advise asking about the lifetime of the cells. She heard that it's 6 months. Is it certain that it's only 2 weeks?
Nothing is certain, unfortunately. We would have to test each patient that received stem cells. Of course, we have patients that during the break where they don't receive stem cells, the 6 months, that there are some results added to the therapy, but this is, again, like I said, information that I received from a transplantologist. Perhaps it's longer with some patients, perhaps with some patients it's shorter. There are different factors that get to that number, such as diet, the patient's state. With older patients, does he or she smoke? Does she drink alcohol? So there's many variances that will lead to the stem cells potentially dying in the body.
Okay, wonderful.
Are you publishing your research results? Yes, we've published so far 2 articles, but this does not concern autism. I can also forward you our papers. It regards a very big group. I think it was 36 patients with muscular dystrophies. And we had also patients with eye diseases. But this paper was in regards to individual case reports. And we're actually working on a new paper now for ALS, so that will be soon in the future.
Okay. If we can receive also some information about autism from the expert, you said the
Yeah,
I forgot the word.
transplantologist.
The transplantologist. If we can receive the professional papers that the opinions are based on, that would also be useful.
With the bibliography, no problem.
Yeah, that would be great.
Mhm.
I think we have all the questions answered. Advamo, any more questions? יש עוד שאלות?
לא, תודה.
Okay. Okay, so Dominika, it was wonderful. Thank you for coming to our group.
What do you
and
add
the
to
information
the
with us.
IV? We only give the patient NaCl. That's it.
What's MACL?
NaCl. So that's just basically salt in an IV.
Oh, okay, okay. So that's saline.
No additional vitamins, no nothing.
Okay. Are there any sort of recommendations for different patients coming for treatments in terms of lifestyle, health, diets?
Of course, vitamin D and C, but we all know that thanks to the coronavirus pandemic, that this is very important to the body. In regards to dietary, some papers suggest that autism is also coming from the gut. So a lot of parents exclude gluten and milk products, but I think that this is a very individual.
Now, the question is if the doctor that does the assessment for a child coming in for treatment, they give some kind of recommendation based on the blood work or
if there's any indication that something is wrong with the blood work, then yes, he will for sure give information what's next or what should be added or what should be deducted.
Okay. Oh, sorry. Moral asked what you think about giving vitamins and supplements.
I mean, there's no issue with that, but we would actually have to test the patient on how his vitamin levels are. Because
is that something that's possible to ask for that kind of test?
It's not impossible, but I don't think that this will actually give anything to the treatment.
Okay.
I mean, patients should be taking their vitamins anyways, so I don't think that an additional IV with vitamins will actually be key here.
Mm-hmm. Okay, so we're coming in for treatment and we're getting a consultation, a psychologist assessment. Every time we get an injection?
No, the psychologist assessment is before the first, fifth, sixth injection, sixth being after 6-month break, and before the 10th. So there's 4 psychological assessments, and each time there's a consultation plus blood work, because we need to see if there's any issues with infections or any irregularities.
Okay, and there aren't any supplemental treatments, any, I don't know, speech behaviorist or anything like that?
Of course, we want patients to go through the whole rehabilitation process, but we don't interfere with it because parents already have patients in schools or with other therapists at home. So the only thing that we suggest is a little bit more, but what they do is very specific to each child individually.
Okay.
So we just ask for the patients to do more, but we don't suggest anything other than the parents are doing already.
I had a question about follow-up. So when somebody comes in to get treatment, they go through the 1.5 years. After that period or during the 6-month break, do you collect information about, is it maybe a requirement to have patients send in data about how they're doing?
Yeah, we do a follow-up via email. with patients.
Okay. Mo, she said that they don't do exosomes. Okay. Okay. Mo, do you have any more questions?
No, thank you.
Okay. So Dominika, it was very pleasant to host you. We have a lot of information. We'll be waiting and posting your research papers that you will be sending in as well. Thank you.
Thank you very much for having me.
Have a good day.
Thank you very much.
Thank you. Bye-bye.
Bye.
Bye.